Bon après-midi et bienvenue à cette conférence de presse. Good afternoon and welcome to this press conference. Je vais maintenant passer la parole au ministre LeBlanc pour débuter. I will now turn to Minister LeBlanc to begin.
Merci beaucoup, Jean-Sébastien. Thank you very much, Jean-Sébastien. Good afternoon, everyone. Bonjour. Today, I am joined by my colleague, Minister Anita Anand, and Doctors Tam and Njoo. Et je voudrais commencer tout de suite en cédant la parole à ma collègue, la ministre Anand. So to you, Anita.
Thank you so much, Dom, and good afternoon, everyone. It has been incredible to see Canada's vaccination campaign racing ahead, with more and more Canadians rolling up their sleeves. To date, 3/4 of eligible Canadians have received at least one dose, putting Canada first in the G7, the G20, and the OECD. And second doses are quickly ramping up, with hundreds of thousands being administered daily. Indeed, 400,000 second doses were administered across the country yesterday, approximately. Our government has delivered more than 35 million doses to the provinces and territories, with 30 million doses administered already to Canadians. Je tiens à remercier sincèrement tous les Canadiens et toutes les Canadiennes qui se sont fait vacciner et j'encourage tous ceux et celles qui ne l'ont pas encore fait à recevoir leur première dose. Comme je l'ai déjà mentionné, mes fonctionnaires et moi-même avons travaillé fort pour que davantage de doses soient livrées au Canada plus rapidement. As a result of those efforts, as the Prime Minister has just indicated today, we are pleased to report that Canada's allocation from Moderna for the month of July is 11 million doses. What's more, these deliveries will be front-end loaded, with nearly 5 million of those doses actually arriving before the end of June, and the balance to be delivered in the first half of July. Along with the 1 million doses that we received from the United States government yesterday, Canada will receive a total of more than 18 million doses of Moderna in this quarter, well over the approximately 12 million doses originally forecasted. Comme mentionné plus tôt cette semaine également, Pfizer a modifié son calendrier de livraison pour le mois de juillet. Mais comprenant bien ceci, le Canada recevra toujours 9,1 millions de doses de Pfizer en juillet. Cela n'a pas changé. Toutefois, les livraisons des 2 premières semaines seront désormais inférieures à celles prévues initialement et les livraisons des 2 dernières semaines seront plus élevées pour compenser et combler la différence. As was also mentioned earlier in the week, Pfizer has adjusted its July delivery schedule. Let me be very clear. Canada will still receive 9.1 million doses of Pfizer in July. That has not changed. However, the deliveries in the first 2 weeks will now be lower than originally planned, and deliveries in the last 2 weeks will be higher to compensate and to make up the difference. In total, Canada is now set to receive more than 50 million doses by the end of June and more than 68 million doses by the end of July. This milestone in our vaccination campaign is the culmination of the monumental efforts of my PSPC team, who have worked around the clock since day one, continually negotiating with our suppliers in a relentless push to accelerate deliveries from later to earlier time periods this year. Our vaccine plan is paying off. We are seeing the results today, and our government will continue to bring millions of doses here for Canadians every single week. As the vaccines continue to arrive, Let us pledge to continue to work together, to keep each other safe, and to finish the fight against COVID-19. We have come so far. Let's keep going. Merci beaucoup, Megwech. Thank you.
Merci beaucoup, Anita. Thank you very much. So over to you, Dr. Tam, and then to Dr. Njoo.
Thank you, Minister. Bonjour à tous. Nationally, the 7-day rolling averages continue to decline, and our current national average of 1,137 cases reported daily is down more than 85% from the peak of the third wave. Likewise, the average number of people with COVID-19 being treated in our hospitals each day is down more than 65% since the peak to 1,430 daily. Of these, on average, 650 people were being treated in intensive care units, and an average of 20 deaths were reported daily. Together, we've made incredible progress in lowering COVID-19 infection rates by maintaining precautions while we work to increase population immunity by expanding first dose vaccine programs and accelerating the second dose programs. The payoffs now and in the weeks and months to come will be invaluable. Just this week, healthcare workers had cause for great cheer as the Medical Surgical Intensive Care Unit at the Toronto General Hospital announced 0 COVID-19 patients for the first time since March 2020. In addition to preventing more severe illness and loss of life, our continued efforts to drive COVID-19 infection rates down everywhere is preparing us for a safer future by building a better buffer against the rise of the Delta variant. As we've seen every step of the way, the secret to all our successes has been people in Canada working together to stay informed, to help out in more ways than we could have imagined, and to step forward when it mattered most. And right now is an incredibly important moment for stepping up to get fully vaccinated. With COVID-19 disease activities waning, we have a window of opportunity to raise immunity as quickly and as high as possible to build a wall of protection through vaccination against emerging variants of concern like Delta. This week, we saw a great response to the start of the Pass the Baton COVID-19 vaccination campaign. The Canadian Olympians and Paralympians starting a relay of reasons on the importance of getting vaccinated against COVID-19. And using hashtag MyWhy, people across Canada are joining in and sharing their own compelling stories, from protecting our health and healthcare system to getting back to the in-person connections that enrich our fitness, fun, learning, and growth. In short, Canadians are doing it for themselves, their families, their loved ones, and to be the coverage we want to see in the world. Working together, we can go for gold and get Canada vaxxed to the max. Thank you. Merci, Megwich.
Bonjour à toutes et à tous. À l'échelle nationale, les moyennes sur 7 jours sont toujours en baisse. Le nombre moyen de cas au pays, de 1137 cas déclarés par jour, a diminué de plus de 85% par rapport au pic de la troisième vague. De même, le nombre moyen de personnes atteintes de la COVID-19 traitées dans nos hôpitaux chaque jour a diminué de plus de 65% depuis le pic pour atteindre 1430 cas par jour. De ce nombre, en moyenne, 650 personnes étaient traitées dans des unités de soins intensifs et 20 décès ont été déclarés par jour. Ensemble, nous avons fait d'incroyables progrès dans la réduction des taux d'infection par la COVID-19 en continuant d'observer les précautions tandis que nous nous efforçons d'accroître l'immunité de la population en exécutant des programmes d'administration élargis de la première dose de vaccin et en poursuivant plus rapidement les programmes d'administration de la seconde dose. Les avantages actuels et auxquels nous bénéficierons dans les semaines et les mois à venir seront inestimables. Cette semaine, les travailleurs de la santé avaient de quoi se réjouir puisque l'unité de soins intensifs médicaux chirurgicaux de l'Hôpital général de Toronto a annoncé qu'il n'y avait plus aucun patient atteint de la COVID-19 pour la première fois depuis mars 2020. En plus de prévenir des maladies plus graves et des pertes de vie, nos efforts continuent pour abaisser les taux d'infection par la COVID-19 partout dans le monde nous préparent à un avenir plus sûr en assurant une meilleure protection contre l'augmentation du nombre de cas du variant Delta. Comme nous l'avons constaté à chaque étape de cette lutte, le secret de toutes nos réussites a été la collaboration de la population canadienne qui s'est tenue informée, qui a apporté son aide de bien des façons, plus que nous n'aurions pu l'imaginer, et qui a agi au moment où cela comptait le plus. Et en ce moment, c'est le temps d'agir et de se faire entièrement vacciner. Maintenant que la propagation de la maladie de COVID-19 est en baisse, nous avons l'occasion d'accroître l'immunité aussi rapidement et aussi étendue que possible afin d'assurer une protection efficace par la vaccination contre les nouveaux variants préoccupants comme le Delta. Cette semaine, le lancement de la campagne de vaccination contre la COVID-19, Passer le témoin, a suscité un vif intérêt. Les athlètes olympiques et paralympiques canadiens ont en effet lancé un relais de raison sur l'importance de se faire vacciner contre la COVID-19. En utilisant mots-clics Mes raisons, les gens de partout au Canada se joignent à nous et racontent leurs propres histoires fascinantes. Les raisons énoncées vont de la protection de notre santé, de notre système de soins de santé, au retour des rencontres en personne qui contribuent à notre forme physique, notre divertissement, notre apprentissage et notre développement. Bref, les Canadiens le font pour eux-mêmes, leurs familles, leurs proches et pour contribuer à la couverture à laquelle nous voulons tous bénéficier partout dans le monde. En travaillant ensemble, nous pouvons obtenir l'or et s'assurer.
Alors, to you, Jean-Sébastien, we're obviously ready to take questions.
Merci beaucoup, Monsieur le ministre. Donc, nous allons maintenant débuter la période de questions. We will now take questions. As usual, it will be one question and one follow-up. Donc, comme d'habitude, ça va être une question et un suivi. And I will now pass it over to the operator for the first question. Je vais maintenant passer la parole à l'opératrice pour la première question.
Thank you. Merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. The first question is from, la première question est de Mike Lecouteur, Global News. Please go ahead, à vous la parole.
Thank you for taking our questions. This question is kind of split into two, one for Dr. Tam and one for Dr. Anand, Minister Anand, but both along the same subject. So with NACI's change yesterday and essentially recommending that provinces stop administering AstraZeneca, for Dr. Tam, I know you say that people should be happy that they followed the guidance and that they got their doses or first dose of AstraZeneca. There's still a number who feel like they're guinea pigs and they're not 100% sure they'll be able to travel to different places. So despite following everything, what do you say to those people? And the other one now for Minister Anand is we have the remaining of the contract of AstraZeneca. What happens to those doses now that it seems like they won't be used in Canada?
Yes, thank you for the question. And I can certainly recognize that people may be asking questions or feel frustrated. But I think, as I said yesterday, NACI is following the science and providing up-to-date recommendations. So the most important thing is to get that second dose. And I think that people who've got 2 doses of AstraZeneca should know that they are being protected in terms of illness. And in fact, the AstraZeneca dose, even if you look at the Delta variant, if you get 2 doses, you have a very effective vaccine for preventing hospitalizations or serious outcomes. What you're weighing your choices against is, some emerging evidence showing that if you receive the first dose AstraZeneca and then you receive an mRNA vaccine, that immune response appears to be very robust and is when the studies were done to compare 2 doses of AstraZeneca with AstraZeneca mRNA, the latter appears to produce a more robust response. So, and this, as you're making that kind of decision, is weighed against where you're in the pandemic, as well as the rare side effects that we've talked about, like the thrombosis with low platelets. So there's many things that I think each individual person receiving a vaccine, of course, should be provided information on. At the height of the pandemic, the absolute imperative is to protect everyone from getting serious illness. So that's what people who've got the AstraZeneca vaccine did for themselves, as well as to protect others as well. NACI's recommendation is one of, prefer to get the mRNA vaccine because they're in plentiful supply. The studies, as I've just indicated, now you have less COVID in our country. And so the risk benefit ratio for the even rare events starts swinging in a different way. But you are, if you got your 2 doses, protected. Today, all the evidence shows it protects very well against serious illness. I do think that needs to be separated from travel requirements. For travel requirements and what might be accepted in other countries is a very topical topic for international discussion. But you got to start somewhere. And I do think most countries is going to start off with the vaccines that they know and have approved. We will also be looking at, for example, the WHO list of approved vaccines. But every country currently is trying to restart doing the best that they can. And they may start off with a smaller list. And they, like us, would be considering other vaccines as we're going along as well. So it is difficult. And for travelers, as I said yesterday, you have to check what the policy of the country that you're traveling to is requiring. I mean, the incident in the United States, I think that was reported about a concert. Now, that could, in fact, be a state or local or, private sector policy. I don't know. I don't have enough information. So I think from our perspective, our continued engagement will be with the national level of the United States.
It's Dr. Njoo. Maybe I can just underline a point that Dr. Tam made and also to your question. Certainly, the NACI recommendation is not to tell provinces and territories to stop using AstraZeneca vaccine. Based on scientific evidence about maybe a possible advantage in terms of immune response by offering an mRNA vaccine as a second dose to those who received AstraZeneca as a first dose, and also the very rare, but there is a safety signal with VIT. There's a sort of a recommendation for a preference, but it's not the same thing as saying stop using AstraZeneca totally. So certainly for those individuals who's received the AstraZeneca vaccine, the 2 doses, hey, you've made a good choice. Certainly, I can say at the time when the epidemic, the 3rd wave was raging through the country, it offers a good level of protection against infection. Of course, very good protection, as we can see with evidence around the world in terms of serious illness and hospitalization. So certainly now with the additional information, provinces and territories will be taking that to heart. But certainly my sense is that if an individual, for whatever reason, is maybe not comfortable with quote, receiving a sort of the mixed dose or getting a different type of vaccine, mRNA, as their second dose after receiving AstraZeneca, certainly my sense is that option would be made available, obviously with full informed consent, understanding what they're doing. But it's not a hard stop to say, no, you cannot give AstraZeneca at all. So I just want to make sure that that's clear as well. Thank you.
And just to respond to the second part of your question, Mike, I will start off by saying that as a result of our diversified portfolio of vaccines, we are continuing to pull in vaccines from multiple approved suppliers. The reality is that we are working very hard with Minister Haidu's team and the Public Health Agency of Canada as their engagement continues with the provinces and territories to determine the extent of their demand for AstraZeneca. Our contractual relationships with suppliers and our contracts themselves are extremely solid, and we will be able to meet any demand that ensues from the provinces and territories. As you have seen already, we have almost 75% of eligible Canadians with at least one dose. Second doses are continuing to ramp up. And from the perspective of public services and procurement, we will continue to ensure that the supply of vaccines rolls into Canada by the millions, 50 million before the end of June, 68 million plus before the end of July, so that all Canadians who wish to have access to vaccine can indeed have that access. Thank you.
Just for my follow-up, Minister Anand, I appreciate that, but the question was, what do we do with the unused vaccines or the rest of them? But that's not my follow-up. I don't know if you want to address it afterwards. I understand that doses are coming in, but we may no longer have use for AstraZeneca, is what I'm saying, and what do we do with those doses? But I will, so you can tackle that after I ask my follow-up, but my follow-up is for Dr. Tam and possibly Dr. Njoo. I wanted to know what the vaccine threshold should be to ease restrictions in light of the spread of the Delta variant, and whether or not there is a concern that we could be seeing a drop-off in uptake of first doses in Canada.
Okay, Theresa, I'll just start by finishing the response to the question and then hand it over to you if that's okay. In terms of the unused vaccine that is available under contract, I want to reiterate that Canada is committed to helping to meet global demand for COVID-19 vaccines. As announced by the Prime Minister, Canada has committed to donating up to 100 million doses. This continues to be a conversation across government as to further donations when that is possible. I will continue to be focused on bringing vaccines into this country and will discuss with my colleagues the resulting decisions relating to unused doses under contract. Theresa?
Thank you. And that was a very important question, and that the last part of a vaccine stretched campaign is the hardest. So far we've seen such a tremendous enthusiasm from people, but the last remaining people who haven't had their first dose yet is an important target of efforts to get more vaccines to them. So now the tactics may have to switch, for example, from mass immunization clinics, which can still occur, but to more tailored approaches to improve access to those who still haven't been vaccinated, but that they may have had difficulties accessing the vaccine. So you will see numerous different strategies to bring vaccine to the harder to reach, to people who are homebound, to other different communities. And we, the federal government, the Public Health Agency, supported a number of community-based projects in order to get those vaccine targets up. It may be language barriers. We're pulling out all stops. But that end piece of our campaign is going to be the most difficult. So in some jurisdictions, we've already seen a slowdown of that first dose while the second dose is ramping up. We need to keep going with that first dose. And as you said, it's because some of the variants who are more transmissible may need a higher vaccine coverage in the community to stop chains of transmission. We will be, doing more modeling information and studies. But all to say is that's why I've said we've got to reach for the stars. We've got to, as much as possible, even get past the 75% goal. We know it can happen because certain age groups, the seniors, for example, some groups have already gone past 90%. So if other age groups can be supported to do that, that's what we would want to see. And that sets us up for a much better fall. If the variant takes hold and we don't have high enough vaccine coverage, what you will see is probably a resurgence in the fall period, which we want to try and suppress as much as possible.
Yes, and it's Dr. Njoo. Just to build on what Dr. Tam said, you're right. We're seeing in different parts of the country that sort of the rate of vaccination for first doses is starting to slightly plateau, and certainly not at the same sort of accelerated pace as it was earlier. And there's two components to that. One is Dr. Tam's very eloquently expresses the accessibility part. People are homebound. Maybe it's not easy for them to get an appointment or to actually go for their vaccine. And so we see that the provinces and territories are using all sorts of means to improve access to vaccine, and even language and cultural barriers. That's one thing. But the other part is the vaccine hesitancy. That's another space that we're very alive to with our innovation fund, and also the provinces and territories. You can see they're using other methods as well, as you might say, to try and appeal to maybe other motivating aspects to why people may then hopefully go forward to get that the first dose, and of course then for the second dose. So those are important things that hopefully we'll get way past that first dose coverage, and then as you say, start focusing on the second doses for all Canadians. Thank you.
Thank you, Dr. Njoo. Operator, next question. Opératrice, prochaine question.
Thank you. Merci. The next question is from, la prochaine question est de Catherine Lévesque, La Presse canadienne. Please go ahead, à vous la parole.
Oui, bonjour à vous tous. Ma première question était pour la ministre Anand. Je voulais juste plus de précision sur les vaccins. Donc, il n'y a pas si longtemps, on nous annonçait 55 millions de vaccins avant la fin du mois de juillet. Maintenant, vous parlez de 68 millions avant la fin du mois de juillet. Donc, je me demandais comment expliquer cette différence de 13 millions. Est-ce que finalement, c'est plus de doses de Moderna? Si vous pouviez nous donner des précisions à ce sujet. Merci.
Oui, bien sûr, et merci pour la question. La situation est la suivante. Le numéro 55 doses avant la fin de juillet était seulement les doses de Pfizer. Mais maintenant, nous avons un calendrier de livraison de Moderna et donc nous allons avoir 68 millions de doses à peu près avant le fin de juillet. Merci.
OK, très bien. Donc, effectivement, dans le fond, vous confirmez que la différence de 13 millions, finalement, ce sont toutes des doses de Moderna, finalement. Dites-moi si je me trompe. Et ma question de suivi, c'est pour le ministre LeBlanc. Je voulais revenir sur, en fait, les voyages et cette preuve vaccinale. Tout à l'heure, il y a le premier ministre Justin Trudeau qui a confirmé en quelque sorte qu'il y aura une solution intérimaire pour cette preuve vaccinale par le biais de l'application ArriveCan. Et il a dit en même temps qu'il y aurait un système plus permanent à l'automne. Je me demandais qu'est-ce qui bloque actuellement? Est-ce que c'est en ce qui a trait aux négociations avec les provinces? Est-ce que ce sont des questions de vie privée? Si vous pouviez peut-être élaborer là-dessus.
Avec plaisir et merci encore pour la question. Je pense que le premier ministre Trudeau l'a abordé plus tôt aujourd'hui. Et vous avez raison, on aura une façon intérimaire et on va donner plus de détails lundi sur ces questions-là afin d'offrir probablement à travers l'application ArriveCan une façon pour les gens éligibles de venir au Canada d'offrir une preuve de vaccination. Et nous continuerons des discussions franchement très, très constructives avec les provinces et les territoires. Ça a été abordé lors d'une rencontre, encore une fois, constructive, très productive, je dirais, hier soir avec tous les premiers ministres. Ça a duré 2 heures. La conversation s'est portée sur des détails de comment nous pouvons collaborer ensemble afin de partager dans les mesures appropriées, tout en protégeant évidemment les questions de vie privée, mais avoir accès aux données qui sont proprement dans les mains des provinces et territoires pour avoir une solution plus à long terme, un genre de passeport vaccinal ou un certificat de preuve vaccinale, toutes ces questions-là sont importantes aussi d'être abordées avec nos alliés, avec les États-Unis, c'est sûr, avec l'Union européenne, avec l'Angleterre. Alors, nous aurons au cours des prochains mois une façon sécuritaire, en partenariat avec les provinces, d'offrir à tous les Canadiens une preuve vaccinale pour des voyages internationaux.
Merci beaucoup, Monsieur le ministre. Je dois vous avertir que Dr. Tam et Dr. Njoo doivent maintenant nous quitter, mais les ministres demeureront disponibles pour répondre à vos questions. So I must now inform you that Dr. Tam and Dr. Njoo must leave, but the ministers will remain available to answer your questions. Donc, je vais passer la parole à l'opératrice pour la prochaine question.
Jean-Sébastien, c'est Dominique. Je crois que le Dr. Njoo peut demeurer avec nous encore pour quelques moments. Dr. Njoo is able to remain with us for a few minutes. It's Dr. Tam who has had to step out.
Ah, OK.
That's right.
Parfait. Ben, merci de la précision, Monsieur le ministre. Donc, parfait. Je vais passer la parole à l'opératrice. I'm now going to hand it over to the operator for the next question.
Thank you. Merci. The next question is from, la prochaine question est de Mia Robson, the Canadian Press. Please go ahead. À vous la parole.
Thank you. Yeah, Dr. Njoo, I'm just wondering if you could talk a little bit more about this NACI decision yesterday on AstraZeneca. I've seen some family doctors and pharmacists not happy with this decision. They say that it created more confusion for patients. There was no documentation provided that was sort of patient-friendly so they could explain it, that there doesn't seem to have been that much change in the data and the studies. They're all still sort of early emerging data, and that this has just added extra confusion and concern for patients. I'm just wondering if you could address those concerns.
Okay, well, thank you very much for the question, Mia. What I would say is that with respect to the NACI guidance, as we've said on several occasions, that continues to evolve with the science. And the science is some of the studies coming out of Europe, looking at healthcare workers, looking at their immune response, are all very positive in terms of looking at a mixed dose schedule. The fact that there seems to be a better immune response for individuals who receive an mRNA vaccine after having received AstraZeneca as their first dose, but also the fact that people who receive AstraZeneca for their first two doses, that there's a very good level of protection. So we understand all that. So I think what's driving the NACI change in terms of sort of a stronger recommendation, a preference for that mRNA vaccine as the second dose for those individuals who receive AstraZeneca as their first dose is based on the fact that, like I said, the immune response appears to be greater. And also with the fact that even though it's quite rare, the fact there is a safety signal with the AstraZeneca vaccine, which was not there, when we first started our vaccination campaign with all of the vaccines that were obviously approved by Health Canada. And that safety signal has not been shown to be the case with respect to VIT, the blood clots with the mRNA vaccine. So that I think is there. The provinces and territories were given a sort of advanced briefing of the NACI recommendations, so they're well aware. And certainly, it's within their jurisdiction to take the NACI advice and recommendations and then operationalize it according to the context, their epidemiology, and what works best in their jurisdiction. So, to your point about at the pharmacy level in terms of patient handouts and so on and so forth, certainly that's something we would leave to the province and the territory to know best, as they say, their residents and what might work best at a local level in terms of patient information. As I said earlier in my to previous question, is that for people who receive both doses of AstraZeneca, you've done well. You've protected yourselves, you've protected your family, you have good protection against infection. Certainly, you decreased the overall risk of onward transmission of COVID-19, certainly at the time when there was the third wave raging through many parts of the country. And also, you decreased your risk substantially in terms of severe illness and hospitalization. Now, with the fact that we have many millions of doses of mRNA coming in, the fact also that I think in many ways they're showing that there's a good immune response or better immune response with that second dose. That's why there is that option, that preference. But I think it doesn't discount the fact that for individuals who have received that first dose and still, for whatever reason, feel uncomfortable getting a dose of another sort of vaccine type and would like to complete their series, certainly my understanding that the provinces and territories, they will take that into account, and certainly as they roll out the vaccines, that would be part of the I would say the logistical aspect in terms of taking the orders from obviously the federal government in terms of the number of vaccines they anticipate being able to use in that respect. So I think at the end of the day, the fact is that we have a suite of vaccines in Canada. We're doing very well, as Minister Anand has said, with respect to first dose vaccination. Hey, 75% of Canadians have now received one dose, I would say eligible Canadians. And now we're moving in very well with the second dose coverage. My understanding is that we're closing in on that 20%. And as you can see, provinces and territories are taking that to heart, and they're moving ahead with their reopening plans, I think, hopefully in a cautious way, looking obviously to make sure that they're not having an adverse impact on the community transmission, and more importantly, straining the healthcare system in terms of hospitalizations. But all things are trending in the right direction. And so I think we just need to keep pushing in terms of vaccination for Canadians.
Thank you. And I'd also like to ask you about the Delta variant and what we know about it in terms of tracking it. It seems the Health Canada website that tracks variants still does not have a Delta or any of the B1617 lineages on there. It seems difficult to get that data at a provincial level. Is it actually harder to figure out whether this variant is in place? Does it take longer? And what does that mean for our ability to actually control any outbreaks?
Well, you've raised a very good issues in terms of data gathering. Certainly at the federal level, we work closely with our provincial territorial counterparts to get data. But you're right, there is a bit of a lag, and we do rely on the provinces and territories in terms of when you do get obviously a laboratory confirmation of cases of COVID-19, to the extent that they can, I just say, sequence the variants to determine if it is a variant of concern, and then transmit that data to us. That there is obviously some issues that we need to obviously work on at the present time, and it keeps changing. Is that I'm aware of in terms of the Delta variant. As of today, I was looking at the latest data. There's about 2,000, a bit over 2,000 cases that have been reported to us, but we always appreciate the fact that it's probably an underestimation. There's probably more cases there. The other aspect that we're also learning from our provincial and territorial colleagues is that, and I think it underlines an important point, is that the Delta variant, certainly some of the outbreaks that have been reported are among unvaccinated individuals, and certainly because the variant has been shown to be more transmissible and obviously also maybe lead to more serious illness. It just underscores the point that people need to get not just that first dose, but that second dose as well. Studies and the experience in countries in Europe have shown that there's a good level of protection against a Delta variant with one dose, but it's much better with two doses. So the quicker we can get everyone to receiving their two doses, the better we'll all be in terms of how you say being protected against COVID-19 in general, but more specifically the Delta variant. So it's something where we're tracking with our PT colleagues, as we say, and it's something that we're very alive to in terms of tracking the outbreaks and looking at what we can do. And I would say, especially what we might call pockets of unvaccinated individuals throughout the country.
Thank you, Dr. Njoo. Merci, Dr. Njoo. Donc, opératrice, pour la dernière question et dernier suivi. So, operator, over to you for the last question and follow-up.
Thank you. Merci. The last question is from La dernière question est de Brian Tumulty, National Post. Please go ahead. À vous la parole.
Yeah, I'm wondering with the shipments that you announced today, it would seem that we should be able to vaccinate all the currently eligible Canadians in July or at the latest in early August. I'm wondering what you think the likelihood of that is, and whether or not there are any roadblocks that have you concerned when it comes to being able to vaccinate Canadians that quickly.
Should I start, or Minister Anand? I think there's two parts to your question. Maybe it's Dr. Njoo. I'll start in terms of the the actual administration of the vaccine. Certainly, as we work with our provincial territorial colleagues, the public health capacity, the actual capacity to administer the vaccines is there, and they're ramping up, and you can see that the doses are being administered at a very good rate. But in many several provinces, the rate is starting to slow down in terms of first vaccines administered. And so, as we've mentioned earlier, the issue of, I guess you might call it either accessibility or vaccine hesitancy is now coming to the forefront. So with respect to accessibility, certainly the provinces and territories are very live to that.
Maybe I'll take over until Howard gets back. Ryan, is that all right? Listen, in terms of the supply, you're exactly right. We do have a steady stream of vaccines coming into the country, and the announcement today is very good news. 50 million plus before the end of June, 68 million plus before the end of July. But the reality is that there are a number of factors that need to be taken into account, and it is for that reason that we are sticking with the time frame that we've previously discussed, being the end of September. What are those factors, you ask? First of all, supply chains are still volatile. There is still a global competition for vaccine. We are watching our supply chains extremely carefully watching every plane land and every shipment get out to Canadians. So I'm not taking my eye off this ball until we have enough vaccine in the country for all Canadians, and that means continuing to operate in this globally competitive environment. The second factor that we should be aware of is that while we have supply in the country, we are still making sure that that supply gets out to the provinces and territories as soon as possible. And then the shots have to go into arms. And so making sure that those factors are taking account of in the process of the timeline and the estimations is extremely important. As you know, we are being extremely careful with our procurements and with our distribution of vaccine to make sure that things stay on the right track. But this is a process, and we will continue to draw down on our very strong contracts to ensure that all Canadians have access to two doses of vaccine as soon as possible. Thank you.
Yeah, I guess just as a follow-up, Mr. I know you said before that Canada paid a premium to be able to pull doses from later in the year into earlier in the year. Are we still doing that? And can you provide us an estimate of what that has cost to move up all of these doses?
Well, to be clear, Ryan, the payment to each supplier depends on the terms of the contracts. And it is not true across the board that we pay a premium for doses that we accelerate. In fact, we have accelerated 34 million doses to date, and the contracts do differ on the extent to which we pay a premium for accelerated doses. So the conversations and the negotiations with the suppliers continue, but our goal, in light of the fact that we are in the middle of the pandemic and we are still requiring supply to get out to Canadians, is to bring in as many vaccines as soon as possible. I will reiterate that Canada has paid fair value for the vaccines that it has received. That is, we are continuing to negotiate with our suppliers for the most expeditious deliveries to Canada at the fairest price. Thank you.
Thank you, Minister
Dr. Njoo, just checking to
Anand.
see if you can at least hear me. Oh.
Yes, we can, Doctor.
Oh, that's fine. For Minister Non-Answer, well, I guess my internet's still quite spotty, so I'm just here if there's any additional questions. Otherwise, I'll just stay off camera. Thank you.
Thank you, Dr. Njoo. Donc, voilà qui met fin à cette conférence de presse. That marks the end of the press conference. Thank you for being with us. Merci d'avoir été parmi nous. Bonne journée.
Merci,
Thank you
bon
so
après-midi
much.
tout le monde. Have a great afternoon.
Au revoir.